My name's Vicky, I'm a practice development nurse.
My name's Joanne, I'm a police officer. Section 136 gives the police a power to remove someone from a public place where they are presenting with issues around mental health. They may be quite random, sporadic, and the behaviour is of concern to us. It's about being concerned about that individual, about their health and well-being, but also about the public around them and the perception of the public around them, and managing their risk or safety of their position or others. We can take them to a place of safety. That can 9 times out of 10 be a mental health unit, somewhere where they can be looked after. At the very last resort, we can use a police station as a place of safety. An A&E is another good example of somewhere we could take them. Section 136 is applied for by a police officer. There isn't an actual application process. The application is taking that person into our care so that we can look after their health and well-being. So that process is about securing them and making sure that we then transport them to the relevant place of safety.
When somebody's been conveyed on a 136 and we've received that person at the mental health unit, we have specially designed suites called Section 136 suites. They are accepted by the nurse, usually the nurse in charge of the unit if available at that time, and the patient is then assessed under the 136. We will have an approved mental health practitioner who will come to see the patient, and we will also get an approved doctor to come and see the patient as well.
My understanding is that on the follow-on from the process that the Section 136 power effectively ends once the assessment process has been completed, and obviously that will depend on how that process happens as to whether we are present or not, or whether we're involved or not at that point.
A place of safety for the purposes of this is a 136 suite within the hospital. This means that the patient isn't admitted at this point in time. They are just brought to the 136 suite to be assessed at this point. The place of safety can change. Should a patient have physical requirements at that time, then they could be transferred over to the A&E, which is another place of safety. As a last resort, if a patient is potentially violent and the risks are deemed necessary, then they can also be transferred to a police station as a place of safety.
In addition to the point that's just been made, if their behaviour or demeanour changes and becomes violent or volatile, when we talk about them going to the police station as a place of safety, it's important to point out that they're not under arrest, that it's about the care of that patient and looking after their health and well-being, as well as the safety of others around them, including the staff members that might be involved.
When a patient is brought in on a 136, they have particular rights. They are currently here for up to a maximum of 72 hours. We obviously try to see people very quickly, and that would be a maximum. They have the right to receive the information in a way that they understand, and they will also be given the information about their detention under 136 through leaflet forms. Should they require an interpreter, these would also be catered for people. Once assessed, you may find that the patient is then admitted formally. There would be another recommendation made for that to happen. They may be admitted informally if they choose that they wish to stay in hospital as an informal patient to receive care and treatment, or they may be discharged back into the community with care and follow-on support from the community teams.
Just to put some reality onto it, an example of a 136 process that I recently went through was we came across a middle-aged lady who sadly was walking down a public road in a nightdress and slippers, quite obviously very confused, and having some difficulties making coherent sense of the world around her. As a result, the Section 136 was applied. We took charge of that lady and conveyed her to a mental health unit locally, who then, once we'd gone through that process, we handed her effectively to the care of the hospital staff. And I guess you pick that process up from there.
We would have receipted the lady in from yourself and give you the relevant paperwork, and then that lady was entitled to a full assessment. The approved mental health practitioner was made aware that the lady was present in our 136 suite, and also the doctor was informed at that point. It was at this point we carried out a risk assessment. It was determined that she was considered to be low risk, and we made a mutual plan with the police that they could leave at this time. She then becomes the responsibility of the hospital. We then made sure that she was adequately clothed, that she got access to food, drinks and medical treatment as required.
Because that was our concern, that she's clearly out and about in a nightdress and slippers, and it's a very cold day, and she's clearly inappropriately dressed and very confused about where she was.
Of course. We tried to find out the details, of course, of the lady's next of kin at that point in time and carers, and kept them well informed of the processes that was going on. It was found that the lady did need to be detained at that point, and she was subsequently admitted onto the wards, where she did make a good recovery and was handed over to community services.
Which is great, isn't it?